Helping someone with depression. Your support and encouragement can play an important role in your loved one's recovery. Here's how you can make a difference. Depression is a serious but treatable disorder that affects millions of people, from young to old and from all walks of life. It gets in the way of everyday life, causing tremendous pain, hurting not just those suffering from it but also impacting everyone around them. If someone you love is depressed, you may be experiencing any number of difficult emotions, including helplessness, frustration, anger, fear, guilt, and sadness. These feelings are all normal. It's not easy dealing with a friend or family member's depression. That said, your companionship and support can be crucial to your loved one's recovery. You can help them to cope with depression symptoms, overcome negative thoughts, and regain their energy, optimism, and enjoyment of life. Start by learning all you can about depression and how to best talk about it with your friend or family member. But as you reach out, don't forget to look after your own emotional health. You'll need it to provide the full support your loved one needs. Understanding depression in a friend or family member. Depression is a serious condition. Don't underestimate the seriousness of depression. Depression drains a person's energy, optimism, and motivation. Your depressed loved one can't just snap out of it by sheer force of will. The symptoms of depression aren't personal. Depression makes it difficult for a person to connect on a deep emotional level with anyone, even the people they love the most. It's also common for depressed people to say hurtful things and lash out in anger. Remember that this is the depression talking, not your loved one, so try not to take it personally. It doesn't help anyone involved if you try making excuses, covering up the problem, or lying for a friend or family member who is depressed. In fact, this may keep the depressed person from seeking treatment. Your loved one isn't lazy or unmotivated. When you're suffering from depression, just thinking about doing the things that may help you to feel better can seem exhausting or impossible to put into action. Have patience as you encourage your loved one to take the first small steps to recovery. You can't fix someone else's depression. As much as you may want to, you can't rescue someone from depression nor fix the problem for them. You're not to blame for your loved one's depression or responsible for their happiness or lack thereof. While you can offer love and support, ultimately recovery is in the hands of the depressed person. Family and friends are often the first line of defense in the fight against depression. That's why it's important to understand the signs and symptoms of depression. You may notice the problem in a depressed loved one before they do, and your influence and concern can motivate them to seek help. Be concerned if your loved one doesn't seem to care about anything anymore, has lost interest in work, hobbies, and other pleasurable activities, has withdrawn from friends, family, and other social activities, expresses a bleak or negative outlook on life, is uncharacteristically sad, irritable, short-tempered, critical, or moody, talks about feeling helpless or hopeless, frequently complains of aches and pains such as headaches, stomach problems, and back pain, or complains of feeling tired and drained all the time, sleeps less than usual or oversleeps, has become indecisive, forgetful, disorganized, and out of it, eats more or less than usual, and has recently gained or lost weight, drinks more or abuses drugs, including prescription sleeping pills and painkillers, as a way to self-medicate how they're feeling. Remember the advice of airline flight attendants: put on your own oxygen mask before you assist anyone else. In other words, make sure your own health and happiness are solid before you try to help someone who is depressed.